Unknown to me, I started to wake up in the morning with all the veins in the temples of my head distended, and was afraid that maybe I was going to have a stroke. At that time, I had a doctor at UCLA, and he also was concerned that it was a serious problem and thought it was sinus related. So I was sent to a sinus expert and I had many tests done, all of which came back as my sinuses were absolutely healthy, which was good news, but nobody knew how to still help my problem. Then I began to notice that I had terrible pain that would radiate along the cheekbone area. And I went to Dr. Villadiego for my usual checkup. He had been my dentist for many years and never really associated that my headaches could be part of a dental problem, since all my doctors were telling me there were other ramifications causing it. But he did say to me, "You have destroyed so many of your teeth dramatically in the last 6 months." My lower teeth were starting to grow sideways, and I had almost no bottom teeth left in the front. And he said to me, he said, "You are severely grinding your teeth at night. Have you had any headaches?" And I said, "Well, funny you should ask." I said, "I've been seeing a lot of specialists because I have severe headaches in the morning." He says, "You have what I call TMJ disorder." He asked me to open my jaw, and every time I did, my jaw clicked on one side. And he says, "You're at a critical stage right now." He says, "because it's affecting the blood vessels in your head, and it's not going to get better." He says, "I can give you a night guard, but that's not going to correct the problem. The impact that you've already had for the last year or more, where this has probably been in its inception, has destroyed the health of the teeth."
Normally, that's how your bite was, because the condyles were not in the proper position. And by readjusting everything, your bite is back to where they should be.
No sooner did I get the sort of prosthesis, as were temporary until the regular teeth were brought in, which did align my jaw correctly, and mouth guards were provided to me, I no longer had a headache when I woke up in the morning. I don't think the word skill is adequate. In terms of his medical knowledge, the fact that I was relieved of pain and that he was able to recognize the source of the problem when many other medical experts had not, to me speaks volumes to his medical ability.